All right, you are now live.
Thanks, Elizabeth. Welcome, everybody, to the Women and Gender Equity Advisory Committee. This is April the 3rd. It is 4:37, and we are about to get started. But before we do get started, I would like to acknowledge that the Halifax Regional Municipality is located in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. The municipality acknowledges the peace and friendship treaties signed in this territory and recognizes that we're all treaty people. I'll just do a quick roll call. Doreen as our vice chair.
Just got here. Thanks. Hi.
Thanks. Welcome, Doreen. Councillor Hinch.
Hello.
Thank you. Councillor Hartling.
Councillor Hartling hasn't joined the meeting yet.
Okay. Cheryl Kopaj.
Here.
Thank you. Liz Fraser. I'll take that as here. Thank you. Rhiannon.
Here.
Thank you. Cheryl Murphy. Thank you. Sonia is not here. Zoe is here.
Zoe has not joined the meeting yet.
Okay, thank you. And I am here. Great. And we have regrets from Hannah Jackson. And in terms of support staff, Tracy is here. Carla is here. Amy is here. And Elizabeth is here. Thank you. If we could move on to item number 2, which is approval of the minutes from March the 6th, 2025. Are there any errors or omissions? Take that as there are none. Okay, so motion to approve the minutes as circulated. We need a mover and a seconder.
I'll move to approve because I love to say it.
Thank you, Liz, and seconded by
I'll second that.
Cheryl Murphy. Thank you very much. So the minutes of March the 6th are approved as circulated. All in favor? Okay, any opposed? Anyone abstaining? No. Okay, so motion carries. Thank you for that. If we can move on then to item number 3, approval of the order of business and approval of additions and deletions. Are there any additions or deletions from the clerk's office?
There are no additions or deletions from the clerk's office.
Thank you. So there is a suggestion that we move item 6.1 to be considered after 9.1.1. And is there a motion to approve that suggested revision to the agenda? Cheryl is approving that. Thank you. And seconded by, thank you, that's Councillor Hinch. All in favor? Any opposed? Any abstentions? Okay, that motion carries. Thank you. We'll move on to item number 4, business arising out of the minutes. There's no business arising out of the minutes. Is that correct, Elizabeth?
That's correct.
Thank you. Item number 5, call for declaration of conflicts of interest. Are there any committee members that have a conflict of interest that they would like to declare based on any of the agenda items? Okay, thank you. So we are going to move item 6.1 after 9.1.1. So we'll move into item 7, which is correspondence, petitions, and delegations. There are none, as I understand. Elizabeth, is that correct?
No correspondence or petitions have been received by the clerk's office.
Thank you very much. So we can move on to item 7.3, presentation. 7.3.1 is an overview of Geo Nova Scotia from Matt Spurway. Matt is the Executive Director of Geo Nova Scotia, and we're really pleased to have Matt with us today for those of you who are not familiar with Geo Nova Scotia, you will be amazed by this this initiative. So, and Matt, you have 10 minutes to present, and then we're going to open the floor to questions and answers. So, Matt, over to you, please. Do you want us to do a quick round of who we are, or are you good for now?
I tell you what, how about I get into my presentation, and then maybe as people are introducing themselves, or we can hear from folks. But I know who some of you are, and I'd love to know who you all are. So I appreciate that, Jackie. But if that's okay, I'll just jump right in. And I see I've got permission to share my screen, so I'll use
That's great.
this
Perfect.
deck to try to keep me on track. So. Thanks. So Geo Nova Scotia, the GEO, by the way, stands for Getting Everyone Online. And our obsession and our focus is digital inclusion. And this slide explains what digital inclusion means to us. There's three major elements: access, devices, and skills. You need to have access to the internet. So for most people, that means home internet access, but it also can mean mobile and data. It can mean public internet access. We're not always at home. Not everyone has a home, or a home that can be hardwired for internet. So internet access is one key piece. Having the appropriate devices and owning the appropriate devices for what you need and where you are is also just as critical. And that third leg of the stool is the skills. You have to have the skills to use the devices and the connectivity with confidence and safety in order to be digitally included. And so where did we come from? So our brief history began almost exactly 5 years ago, right now, in the very earliest aftermath of the lockdowns, or within the lockdowns of the pandemic. I was working in Dartmouth North on a provincially funded initiative called Between the Bridges. And we were essentially a pair of full-time facilitators to provide backbone support and facilitate the community, together with people and representatives who work in the systems, health, education, what have you, housing, you name it, and where possible, community members and businesses, the private sector. So collective impact was what we were told to do, and go and work in Dartmouth North on these things. And it was when everything got locked down and suddenly the community couldn't join us as we were all jumping on Zoom. There were members who didn't have devices or didn't have the connectivity. And when we met with all of our partner organizations in the community, they had the same problem. The people they were trying to serve couldn't follow them online. And so it really kind of elevated this collective challenge we had. And so the GEO project was born on the side of my desk. We started with a few $1,000s from the Public Good Society, where I'm a board member. And that year we collected through a bit from the United Way and a bit from here and a bit from there. It was just around $25,000. And that year through this little network of local partners, we distributed 50 refurbished desktop computers and made 40 home internet connections for people who didn't otherwise have it. Building on the success of that inspirational work, we were able to receive a few different pockets of funding. Some of it was that COVID money that was floating around that had to be spent by a certain day, and others were year-end scraps from a couple of government departments. But we got enough to set up 4 regional pilots that we called Geo Nova Scotia, and I coordinated them from my home here in Dartmouth. We set them up in Cape Breton, in the Valley, and HRM, and the Southwest Shore, and scaled up what I had been doing. Got better deals with Eastlink, began to buy new Chromebooks from a big supplier, and to spend about $700,000 and connected hundreds of people to the internet and distributed hundreds of devices. And based on that success, we presented ourselves to the new provincial government in early 2022. And they have been buying into what we're doing. DCS, now OSD, has been our primary source of funding altogether over those 3 years. Just to give you a sense of scale, about $8.5 million, most of which from DCS, growing each year, and some other bits from some other little places. And then here we are this year, just kicking off our next full fiscal year. Our budget this year has more diversified funding, but still a lot from the provincial government. A little over $5 million, hopefully, will be where we're at. And it's just all about more growth and partnership. So it's been a very exciting and rapid growth period. a sense of what we've accomplished over that period of time, over the last 3 years as a full-fledged organization. So I know you're probably dying to know, like, how do you even do this? So in a nutshell, we make partner relationships with existing service providers. We call them our referral partners. They're usually nonprofits, a couple in the public sector like Schools Plus. And these are folks who work directly in community with people who, usually not for digital inclusion reasons, they're there for some other reason, but digital inclusion becomes a challenge, and they're working with people who might struggle with the cost of being online. And so we leverage those relationships to reach into those communities and connect and identify people who need the support. And so each of our referral partners essentially gets a little budget or allocation every few months of people they can send to us. They tell us what's needed and we provide it. So up until the end of February, anyway, when I made this slide, our tally was just over 5,000. We say 5,371 participants. Those are participating households. So that doesn't count all the members of those households. Now, probably 1,500 or more are single person households, but the rest there are more participants. You can see the numbers. We've distributed thousands of brand new Chromebooks and headsets, just like the one I'm wearing. Some employment and post-secondary streams require beefier devices, so laptops come into play, and well over 2,000 home internet connections that we are sustaining around the province, all at no cost to the people who've received them. An iPad program specifically originally designed for youth with special needs. We're using iPads at school to learn to communicate. And then if you can imagine what it might be like to then go home and not have that technology. So we've moved to fill that gap, and we've found some other niches where that's a successful product. And then 2024 was a big year for us last year. We put the pieces together to be able to replicate what we were doing with home internet and Chromebooks and start doing it with phone plans that have data and smartphones. And that has been incredibly well received. And I should say, you'd be very interested to know that Geo Mobile, as we've called it, was launched largely because of some startup funding that we got from the Office of the Status of Women, from the National Plan to End Gender-Based Violence. We've got 5 years of funding from them that is putting phones and connectivity into the hands of women and children fleeing gender-based violence. We're very proud of that work. So one of the other advantages of that process that I've described, it allows us to reach, again, into communities that otherwise, wouldn't give us the time of day if I started knocking on doors trying to hand out free stuff, right? Because we actively seek out partners in different geographic communities, partners who provide different types of services to different kinds of people. And so as you can see from the data, this was from our previous full years of participants. We're crunching the data on our last year now. But as you can see, we've got a great diversity from a background perspective, from age group. The lived experience is something, this is all self-identifying, but you can see whether it's living with a disability, single parenthood, housing insecurity, newcomers to us, LGBTQIA+, far more than what would be a standard representation of the population. And so it should be. Again, similarly with other marginalized communities, historically marginalized communities here in Nova Scotia, like the Indigenous and African Nova Scotian communities. So we work hard to find partners and ensure that we're providing enough support and services to overrepresent those groups to try to undo the harm that's been caused for so long. And then I'm sure, again, you focused in on the gender circle for this particular group. And unsurprisingly, a program that effectively is targeting people who are in poverty, unfortunately, is going to find itself with a lot of female participants or non-male participants, let's say, because there's definitely other folks who self-identify differently and are need this kind of support. So this is the few programs that we currently have that I've been describing. So GeoConnects is kind of that flagship program that just churns out devices and connectivity through partners to people who need it, mostly Chromebooks, laptops, iPads, and broadband home internet. Mentioned the Geo Mobile. So we have a selection of like new smartphones. Buying new smartphones is ridiculous. If you've ever tried to buy one that's not attached to a plan for financing, but we have some great like new, and we've made sure that there's a choice. So if someone prefers or wants an Apple or an Android device, That's a choice they get to make, and where necessary, we've got some nice phone plans with data that can go with them. And the third leg of that stool, as you'll recall, is around skills, and we don't ignore that. The way we address that is through a program. It's now a multifaceted program. It's called Digital Champions. It's modeled after a very successful similar program in Scotland and the UK that's been going on for years. And the version that we run is kind of a train the trainer. They are workshops. They're engaging kind of skill development workshops for those staff and volunteers who are already in community, who are already sitting beside someone, helping them out. And this is a way of empowering them, upskilling them, giving them more skills, resources, support, tips, and tricks about how to help people with their individual digital skills kind of in that moment. And we've been actively growing that. And now I just got a few slides showing you some other kind of cool initiatives that we have outside of those mainstream. One of them is this wireless hotspot, nicknamed a MiFi device that we've worked with local partners to bring into Canada to have licensed for use by the CRTC, and through local Nova Scotia IT technology
30 seconds.
developed device management and filters to keep it safe. So neat potential there. We're literally just launching a social enterprise to take advantage of our buying power and distribution, so we can provide discounted services, discounted hardware to all those nonprofits and service agencies who are themselves struggling with the cost of technology. And this October, we'll have our second annual Geo Forum. This time we hope to do a hybrid conference, so we'll be in Halifax and online, hosting conversations talking about how digital inclusion affects people. And I pulled together these few last little bits about how some of what we're doing would interest what you're doing. Our expanded crisis mobile program, which is providing pre-activated phones to women in crisis on the spot. Status of Women is working with us to explore assistive technology for women living with disabilities later this year. We hope to expand our Geo Champions training to include device safety, coercive control. How can we combat technology facilitated abuse as it's on the rise? And a couple of things that I really wanted to hopefully catch your interest in, because I actually spoke with the HRM Social Policy Committee maybe a few years ago about this, because this is a space where the municipality really has a role to play, is we've got designs and ideas, not formal designs, mental designs, on something we call a Geo booth, which is like a great big kind of virtual roll-in accessible phone booth. But imagine it in a library or community center, and it's facilitated by a person there to let people in who are scheduled to use it, because there are video calls that we're requiring people to make now. It could be a job interview, it could be a caseworker, it could be your legal counsel, it could be a court appearance, it could be a reporting domestic abuse. There's conversations that people need to have, and they need to have them privately, and they need to have them safely. And a lot of people at home might not have the technology, or it might just be quiet or safe enough to have that conversation, or they might not have a home in the first place. So Status of Women is interested in exploring this idea, and we would love HRM to also join us to figure out how we can use municipal space and people and services to support not only that, but the Geo Gazebo idea, which is the idea of building charging stations and public Wi-Fi and targeting them in areas and communities where they don't exist. So where are the Wi-Fi deserts within our municipalities? Where can we target and putting 24/7 public access to the internet? So whatever your situation is, you can have that connectivity. So I know I went a little over time there, but I hope that was interesting enough to provoke some questions and maybe some conversations in the future.
That was amazing. Thanks, Matt. I appreciate that. Every time I hear you speak, I'm always wowed by the innovation, because it's not the same slide deck. It's always growing in terms of innovation. So thank you again for that. And unsurprisingly, Matt, we do have a speakers list. And so I'm going to just suggest that I'll introduce people on the speakers list. And if they would like to say a little bit more about their positionality in terms of why they're asking you the question they're asking, they can do that. So first up is Doreen Redmond, who is the vice chair of this committee. So Doreen, over to you for your question, please.
Thanks, Jackie, Matt, and thank you for the presentation. little bit of a context. I was around the executive table at ECD when COVID hit. And I'm struck by the lessons and the vulnerabilities that were really laid bare all across the board, but especially when it came to technology. And talk about really good timing for having you folks coming on board to be able to help us take a look at this issue of these digital deserts. And I'm going to call them that because that's what we were calling them, and how to access and support a system when we didn't even know who didn't really have access. I mean, we were able to bring kids to school, they had access there, but when school was no longer in that one spot, it really showed us where we had a massive amount of work. And I'm really impressed or pleased to see, because it's been a couple of years since I've been at ECD, to see the amount of support financially that your organization is getting. That being said, I'm curious because COVID gave us that gift of being able to see more clearly where the needs are. So I'm curious how you guys are taking a look at how to keep yourself sharp and making sure you do recognize and know where those vulnerabilities lay. And are they the same? Are they changing? Are they evolving? Not that I'm expecting the answer, but what kind of processes are you using to be able to be clearer on that as you move forward?
Thanks for the question, Doreen. I think, one of our strengths is the relationships and the kind of constant communication loop we have with all of our partners. So using the collective impact approach from Between the Bridges, we call it Stone Soup now, but we really invite everybody involved to feel like an equal partner in figuring this out. Nobody's done what we've done before. And that gives us a lot of freedom to say, I don't know, what do you think? Let's try this and see what happens. And what do you know? And what have you learned? So the reason why the slide deck keeps changing and evolving and improving is because we keep responding to what comes back from our partners. And they could be partners in government. So we meet with Status of Women a year and a half ago, and they say, is mobile a possibility? And we're like, well, maybe let's, and now here we are, right? And the same has come from the wireless, so on. And I think that's how we do it. We've seen other approaches. I would say I've seen other approaches where you can take an academic approach to a problem. Let's research. Let's report, recommend, and then put it on to decision makers who go, oh, let's try to make some sense. And I think that can work. But there's another approach that says, let's start. Let's just start solving an issue together and figure it out as we go. As long as we're not doing anything that's going to cause harm, right? Or is unfixable. Let's just get out there and start, as you saw, just little bits. And that has created, what we've discovered is that there's so much existing energy for this topic, but there's no place for it to have gone. And
Right.
it's like static electricity. As soon as you touch it and there's a place for it to go, it's starting to flow. And so it's
Yeah.
information, it's resources, it's relationship. It truly is systems change. And so we
Yeah.
don't quite know what's coming around the corner, but we know how to find out. And that's by listening and talking a lot.
Great,
So-
thank you. Thank you for that. So we're going to keep moving through the speakers list. And so next up is Councillor Hinch. Over to you for your question or observation you'd like to share, please.
Thank you, Jacqueline. To be honest with you, I never knew this existed. The more that I, being in this position and as a counselor, I'm learning more things and seeing more things, and I'm surprised that this even exists, to be honest with you. My question would probably, and soon as you talked about the program and everything, I automatically went to our seniors that are having difficulties navigating the tech world and things of that nature. And I'm wondering, I don't know, I'm just pretty much wondering, how come we never knew, or I never knew, or do our seniors even know about the program?
Mm-hmm. I appreciate that. And we get this a lot, and there's a reason for that. And because the main thing we do, as you've heard, is give away computers and internet connections. We give away thousands and thousands of dollars worth of free stuff to people who need it. And
Right.
so we haven't been able to advertise that that's what we do. Because if I did the first media interview that I was asked to do a few years ago, we would have been dead in the water, because there would have been a news story about an organization that gives away free internet computers to people who need it. And everybody involved, us and every partner we have, would have just been inundated with calls of people saying, can I get that? And we'd spend every day just telling people, no, we're not there yet. And that's, so we have intentionally been under the radar for a lot longer than a conventional nonprofit that's out there trying to tell their
Mhm.
story might be, right? So we kind of
Mhm.
sneaking up on people, but it was quite intentional. It's only now that we've got enough established, that we've really figured ourselves out, that we've got a lot of good data, that we've got a system. I mean, we have developed from scratch a computer system that is as secure as a medical system might be, to take those thousands of referrals and process them with a team of 6 facilitators and support staff. So we've been trying to figure ourselves out far more than we've been trying to spread the word. But this is where we're at now. We're pivoting to really trying to use what we've done as a launch pad to drive the conversation around the need for digital inclusion, our collective responsibility to make it happen for each other. We put ourselves in this situation. We put the person without internet in the place that they're in for not having it. So we share that responsibility to make it happen. So you're not alone, but now's the time, I think, to really elevate the conversation, raise awareness of the topic, and keep finding more partners who are saying, what's my role in this? Because we all have a role to play, individually, organizationally, even every level of government has a role to play. So I'm grateful to be here.
Yeah, I always talk to the seniors and they're talking about feasibility and, their income and everything. And, being with a company of sorts, and it's quite expensive at times, especially just to have a cell phone and do that and have that monthly bill. So
Yeah.
yeah.
Absolutely. And seniors are a very unique demographic here. Sometimes it's a skills issue only, familiarity, but cost is obviously a big issue. And we've had nice conversations with the Department of Seniors, and hopefully someday we can find a way to work more directly with them, because social isolation is incredibly harmful, and digital inclusion can do amazing things. It's transformative when
Yes,
people are connected and have the skills. I appreciate that. Yeah.
sure. Thank you.
Great, thank you. We'll move on to Cheryl Kopach for the next question or observation. Cheryl.
Hi, I'm very excited about this program. I, as along with Councillor Hinch, didn't know about this till now. And I'm just really curious about the work that you've been doing with Indigenous communities. I seen that you had a 10.6% of Indigenous people being serviced. And I know that a lot of our First Nation services, our First Nations communities saw this as a gap and provided, like in my home community, they provided internet for every household in the community, and I know a lot of other First Nations
Was
have
that
done that.
Pugnatek?
Budaladek,
Oh, sorry.
Swaganegedy, yeah, like all of these communities all have internet
Yeah.
in their
Yeah.
houses now. But I know there is a serious gap with our off reserve. So I'm wondering, in particular, what work have you done in collaboration with the Friendship Center, maybe the seniors group that they have there, and also the Nova Scotia Native Women's Association, because they have the Resiliency Center and the Jane Paul Center, which both service very vulnerable women.
Thank you. Yeah. So we have been very proud to grow referral relationships with a number of Indigenous serving organizations, and patiently and respectfully. The easiest, quickest ones was the Friendship Center, because they were in town when we got started.
Yeah.
And so and we also give those organizations kind of disproportional allotments as well. We could never meet the demand,
That's
but
right.
we can recognize that. So the Friendship Center gets a nice allotment. They identify which of they pick a
Yeah,
few
they haven't.
programs to provide some access. And Jane Paul was actually one of the next ones that came on board and on our radar. And we've since added the Native Council of Nova Scotia. We've got Eskazoni Mental Health is one of our
Yep.
biggest partners, and we just added Pictou Landing, I think, Pictou First Nation. So, it's an organic kind of relationship based, finding our way into different
Well,
organizations.
I just
And yeah,
emailed the new coordinator for the Resiliency Center in Millbrook
great.
and said, you need to reach out to Matt, because I think this
Thank
would
you.
be a wonderful program, especially for Booth, because they provide a lot of services for women, especially court, child visits,
Well,
prison visits, all of that stuff like
like
that.
this
That
is
need a secure
exactly
place.
it, right? It's completely unfair that we put people through systems that require engaging, all kinds of very difficult systems to begin with, and then don't provide the tools to do it. It's like building the school, not having the school bus. Like we never think
Yep.
twice about why we wouldn't make sure there's a way for kids to get to school, and yet here we are. Anyway, so all that to say, Cheryl, I think that's great, and it is. I know we're probably going over time, but that's an area where we have to find more funding avenues as well, right?
Yeah.
We can't turn to one department in just the provincial government and say you've got to help, because especially on reserve communities, there are other avenues of responsibility.
Exactly.
So we hope to just set an example of what can be done.
Yeah.
But thank you for that question. Yeah, it's important to us.
Thanks very much for that question. I appreciate that, Cheryl. So we're going to move on to Liz now for the first, for any questions or observations, Liz, that you might have.
Yeah, well, I'm glad to see all my colleagues are sitting down because I'm about to shock them. I think for the first time in my tenure on this committee, I can't find anything I don't like about this. It's great. It's a classic grassroots poverty alleviation project. You're scaling it beautifully. Those geo booths are a genius. When I was working outreach, I would have people come into my office so they could use my computer to attend their virtual court or attend their child protection meeting. And as you say, it's a tremendous injustice. So amazing work. Looking forward to hearing more about it in the future.
That's great.
Thank you.
Thanks, Liz. So we'll move on to Rhiannon. Over to you, please, Rhiannon.
Yeah. Hi, Rhiannon. On this committee, my role is like public woman, but during the day, I'm the co-executive director of Rainbow Refugee Association of Nova Scotia. We are a partner with Geo Nova Scotia. So just wanted to shout out the very cool work you do. And thank you for that. It's I remember meeting with one of the digital inclusion facilitators, I believe, and just stopping halfway through the meeting and saying, how is this possible? Is this a gag? You really do this? And I just think it's very innovative and amazing, and appreciate you taking the time to come and connect with people who are connected to different communities across the HRM here.
Well, no, thank you. And I remember, I think we had that organization join on not too long ago in a slightly unconventional way. I think it was trying to help a family in crisis, and we did it and then got you signed up and made it official. But it's wonderful. And I mean, really, the thanks go to you, that organization, all the others that we work with. We support them. They do the hard work. They do the difficult work. They take it on the chin and are helping people directly. And we are facilitating that work. And we just love to play a role.
Great. Thanks for that, Rhiannon and Matt. So we'll move on to Cheryl Murphy next. Please go ahead, Cheryl.
Hi, Matt. Thanks for your presentation. I did know about it. Now, how did I know about this? Cannot remember where I heard it first, but I did know about the program because, and I remember it because I have a friend who is relatively computer literate and, thought maybe she should connect with one of the partners in order to maybe get some literacy training. Anyway, of course, I love the idea, but I really love the GeoBooth idea. I don't know who said it, who talked about having people come into their office and ask to use their computer to do their whatever it was, their custody case or whatever. But someone who is so marginalized already is even more marginalized by the fact that they have to ask for that kind of service, that they can't, they can't provide it themselves. And then they have to ask. It's just, so what you're doing with the GeoBooth is absolutely wonderful. Thank you.
Well, thank you. We had that idea a few years ago, and it's been sitting in a drawer waiting for its moment. And I think this year might be the year where we find the partners to start prototyping it. And I'm sure there'll be fun design questions about how do we make it accessible and put it through some different lenses and figure out how to do it. How can it be soundproof enough and safe enough and cost effective, and how do we book it? It's going to be great. And I think, I know this is but rural and remote, it's even more of a concern, right? I know we've closed courtrooms over the years and people are hours away, and getting warrants out for their arrest just because they're not showing up, or custody being refused because people can't show up. It's heartbreaking to tell someone that they have to do something that they can't do and not putting a situation in place. It's terrible. So thank you, Cheryl. We're really hopeful that that idea will see it's the light of day. And we need HRM support. I think we can be the partners that just show how it's done. Just jump in and say, yeah, we'll give you some library space here and there, and make sure the librarians are empowered and equipped to go unlock that thing, and when an appointment's set, and let them go, and we'll just sit down together and figure it out.
That's
And then
great.
in a few years, they'll be all over the country.
Yeah, that'll be great to see that happen. Thank you for that, Matt. And Matt, I had a question for you about the, so you have 28.8% male and 67.5% female, and you mentioned that most of or a lot of the females are in need of services that support them from getting away from domestic abuse, et cetera. And so I'm wondering, is there an opportunity for Geo Nova Scotia to provide the sort of digital solution, but also to provide additional linkages to services? So a partnership with 211, for example, so that if you're giving a phone to somebody who's in rural areas, just to link them up with what are the services available for them, and if that's something that could be kind of integrated into the Geo Nova Scotia programming.
Yeah, I love this question. We're trying not to do things that are already being done well. So we don't want to be, another navigator out there. 211 is the Geo version of navigation. It was a problem. If anyone who worked in the nonprofit sector before 211 kind of came to be, we all had the same problem. There's a bunch of services and no one knows what they are, and no one knows how to reach them. And we're always making up little booklets for each other about services, and they're always out of date. And now there's one place you can call, and it bundles that problem up and makes it big enough that a system can apply itself really well. And we love 211. So I just want to give you this. This is one of our projects this year. If you look at it, this is exactly, by the way, the size of my phone, and it's called the Nova Scotia E-Mental Health Pocket Guide. We got a little grant from the Mental Health Association, and each page has the descriptions and it's fuzzy, the descriptions and the QR codes for all the mental health apps that the province pays for to make available for free. And then it's got the same information that you get if you were online to see the intake numbers. There's a 211. I think 211 is in here. Should be the kids helpline. So that is to say that we recognize that there's an opportunity, a moment there when you're sharing this technology to try to put information in the hands of those people that are going to be most useful to them. And when we were talking to Status of Women earlier this week, that same idea of what is information about phone safety? It's different for women fleeing violence. The way that phones can be used to track people or harass people, or things can be put on them. And if you don't even know what you don't know, right? So how can we, I think there's so many more opportunities we can get for creating, nice, easy, accessible bits of information that provide those digital resources to people. Yeah, thanks, Jackie. It's important. Oh, you're on mute. That has to be said at least once in every Zoom call, I think, by law anyway. So thanks for.
Yeah, I'm still jet lagged coming back from Toronto, but it's not that far away, but it's far enough away. I just wanted to say thank you to Geo Nova Scotia for the great work that you've done with the tuition waiver programs in Nova Scotia, and this was a great partnership. So for those of you who don't know, there's a tuition waiver project that I'm working on, looking at reducing barriers to post-secondary education for those with experience in the care system. And one of the things we noted in our scoping review was a lack of digital access. So whether it's Chromebooks or phones or whatever for former youth in care. So you get a tuition waiver, but you don't have the electronics you need to do your homework, really disadvantages that segment of the population. So I'm really pleased to know that there's a number of tuition waiver programs that have reached out and partnered with Geo Nova Scotia. So thank you for that, Matt.
Oh, we've been very excited for that one. Thanks.
So I think we're out of time. Unless there's another pressing question, I think we will set Matt free back into the wilderness with our gratitude for coming to speak with us today. And definitely Geo Nova Scotia is something that is very important to this committee, particularly given the outreach to women fleeing violence. So thank you very much, Matt, for your presentation.
Oh, thank you very much for inviting me. It's my pleasure.
Thanks. Take care, Matt.
Good night.
Good night. Okay, so we're gonna go back to our item number 8. There were no information items brought forward, so we're gonna move into item 9.1, 9.11, which is the Halifax Regional Police Victim Services Unit. And we are going to invite Dolly Mosier, who's a coordinator of victim services from Halifax Regional Police, to present. Dolly has 10 minutes, and then we have a speakers list. And so I just wanted to say welcome, Dolly, and thank you for joining us. So we're going to turn the floor over to you for the next 10 minutes, and then we'll have a series of questions for you. Thank you again.
Great, thank you. Hi, Tracy.
Dolly, I've promoted you to co-host so you can share your slides, but I could also share them for you if you prefer.
Oh, could you, because I didn't switch them over
Absolutely.
to my home.
Yep.
Thank
Just
you.
1 second, I'll bring them up.
While Elizabeth is putting up my slides, I'd just like to take this opportunity to thank you for allowing me to come and present to you today. And if anybody caught the Board of Police Commissioners meeting yesterday, I was on that one, and I tried to cut my slides down from 29 to 9, so so to keep it to 10 minutes. I tend to go on. So a little bit about me. I have been involved with victim services, running the unit as the manager now I'm going into my 8th year. Prior to that, I was with the RCMP for 16 years, but it was all done in the HRP building. I was the baby steps of integration between the RCMP and HRP. So I've been around, like I said, since 2002, actually, in HRP. And so I was able to learn within what the unit was all about. And then I worked as the high-risk case coordinator and did files with HRP and RCMP. And so I learned a lot about the unit. And then when Verona Singer retired in 2017, I applied and was successful in becoming the new manager there. Can you advance the slide? Or can I? Okay, great. So a little bit about victim services. We are a police-based victim support unit. There are other victim service units as well. There's our CMP Victim Services and the Department of Justice Victim Services, and Military Police also has a small victim services unit. We support Halifax Regional Police. We were established back in 1996 to provide supportive services to victims of crime. We have a special emphasis. We work with victims of domestic and sexualized violence. Those are our mandated, but we work on, as I said yesterday to the folks at the Board of Police Commissioners, we see people on the absolute worst days of their lives. Whether it's, there's just been a domestic violence incident, or there's been a tragedy, we get called to all of those types of files. So we're a very small staff, but we're a very mighty staff. We're a great team. We're located over in Burnside in the East Division, right where that police sign is. Those are our windows right below, and the East Division is right downstairs. So we're often integrated in whatever they're doing downstairs. Next slide. So our team, as I said, we were pretty small, but we are expanding. Council just approved a new caseworker and the Devon program, which I'll talk about, to a full-time position. I'm the coordinator, of course, the manager of the unit, and we have a business support person who does our admin and our crisis, he typically is the first person that someone in crisis would speak to when they called our phone line. Matt has a counseling degree. He spends lots of time on the phone with victims who are calling looking for information on their police case. As I said, sometimes in crisis, so he kind of talks them down, stabilizes them a bit, and makes the proper referrals to where they need to go. And then at some point, we'll transfer them over to one of us. We have a sexual assault caseworker. She specializes in all of our sexual assault files. Allie works in the office 4 days a week. And on the 5th day, she is over in our integrated criminal investigation division, working in the SATE unit. We find that having her integrated right into that unit 1 day a week provides officers with the opportunity to have a caseworker that can speak with victims who are coming in to give a statement, who are, usually traumatized after their statement or need to take breaks during their statement because sometimes they're 6 or 7 hours long. So having Allie in the unit is a great opportunity because there's someone there who can speak with them in a trauma-informed, uses a trauma-informed approach and certainly provides them with all the resources and referrals that they will need going forward. Our domestic violence case coordinator works specifically on high-risk domestic violence cases, cases that are designated high risk. In the province of Nova Scotia, we have the high-risk case coordination protocol, and all police agencies across the province use the high-risk protocol. Once a case is designated as high risk, our domestic violence case coordinator will coordinate all of the service providers that will be needed for that one specific victim, and will support her through whatever. And I say her because 97% of our cases are with women. So she will support her throughout, post-incident and onwards throughout the case, as long as it takes to go to the court section. And we have, we're very pleased and proud of our domestic violence offender navigator. We are the only police agency in Nova Scotia, or in Canada, sorry, to have a position within a police unit that actually provides services to offenders. And the way that it works is back in 2018, we were provided with a domestic violence police officer that works solely in our unit, works solely with the offenders in that unit. And what his role was to call the offender and talk to them about, do you understand what your conditions are? Do you understand, how you're supposed to access services? Do you understand all of those things? And he came to me and he said, I'm really having difficulties in this role because I'm running into guys who just want to make things better. They want to reunite with their partners. They want to reunite, or they just want to co-parent safely, and they don't know how to access services. So he said, I find it difficult because I'm kind of becoming their go-to guy to get help. And then if a breach comes in tonight, I have to go arrest the same guy tomorrow. And I'm finding that a very difficult balance. So I thought about it for a while and I thought, what if we had the same opportunity to add to an offender? Now, this is an offender who is accepting responsibility for the crime that he's committed. If we had someone who could guide the offender through the same processes that we're guiding the victim, what would that look like? The majority of our referrals actually come from victims who will call us usually the next morning to say, I want him to come back home. I didn't want him to be arrested. All I wanted was for him to be taken away for the night so that I could have some peace. And now he's been arrested. Now he's in jail. I don't know what's going to happen. I need him home. He's the caretaker of the children. or, you know, without him here, he's the breadwinner. I don't know where I'm going to get money. So oftentimes, and oftentimes the victims really don't want to split up with their partners. So with these offenders who are absolutely accepting responsibility for what they've done and want to either safely co-parent or reunite with their partner, we put them in touch with our domestic violence offender navigator. And Wendy's 45 years, Wendy Keene, she was the executive director at Bryony House for quite some time. And her last role was as the executive director with New Start Counseling. And so Wendy came to us, took the position and basically, you know, created something that we're so proud of. And we have police agencies from across the country reaching out to us saying, how are you doing it? And what does it look like? So what it looks like basically is Wendy will get a referral from our domestic violence officer. Our officer, when speaking with the offender, will ask him, you know, if this is something that he's interested in. Wendy will give him a call, have some conversations around, you know, how he's doing, you know, what has this experience, you know, been like for you. And offenders are really surprised to get that kind of a phone call, I can tell you. And some of them cry. Some of them start talking about, you know, what they've been through in their lives. And so what Wendy will do is make referrals for them, navigate them through finding a place to stay if that's something that they need, helping them to navigate the child protection so that they can get access to their children. She has on many occasions contacted their employers to, you know, after they've, you know, told their employers that they've been charged with something, to navigate getting them off early, maybe a little earlier, going in a little late so that they can attend their counseling. And then Wendy created a partnership with Brightside Counseling so that we can get guys into counseling immediately without that, you know, 3-month waiting list, or having to wait until the whole criminal court proceedings are done. Pardon?
30 seconds.
I can't hear you, Elizabeth.
Oh, I'm not on mute. I was just saying 30 seconds.
Oh,
left.
I only have 30 seconds. Okay, I'm going to keep on going then. Go to the next one. And we have 12 volunteers that are very active, come in and do all the work that we need them to do when we're not in. So our goals are to enhance the services provided by police to victims. We provide a coordinated response to victims in cooperation with, we have many community agencies. We increase the awareness of victims' issues and community-based services through our education. And we increase supports and healing for victims through research and education. Next slide. We support all victims of crime, so domestic and sexual assaults, as I said, are prime, but we also support victims of robberies, sudden deaths, suicides, homicides, and other victims as referred by officers. If charges aren't laid, oftentimes officers will see that people need help, so they'll give us a call and ask us to check in with someone. And next. What do? We do crisis intervention, of course. We provide victims with their police case information, provide emotional support, very short-term counseling. We do a lot of safety planning. That's our main goal. We advocate for victims through other services. We do referrals, and we liaison between the police and the victim, and we do crisis on-scene support. And we get our refers automatically. They come into a queue every morning. I read them and assign them, and we get direct referrals by police, or we get clients initiate their own contact. I think there might be one. And our other programs include Peace Bond Navigation, Community Mobilization. We're part of that team for the emergency response, the emergency protection orders. We conduct safe space, safe place workshops for the workplace. We take referrals from the medical examiner's office, and we have all of our brochures translated in several languages for victim support. And usually when folks call us, we will triage, when police call us, we'll triage the situation. Not all scenes are appropriate for us to get to. Not all victims want us or need us there. So sometimes we'll just kind of linger nearby, or we'll be in touch with them by phone, whatever their need is. I think that's it. Yeah, that's it. Sorry, that's 19 slides into 9.
Thanks very much for that, Dolly. That was a great presentation. We're going to go through our speakers list, and we're going to start with Doreen Redmond, our Vice Chair. Thank you.
Thank you, Dolly. Mine is just a quick question. One of my roles here on the committee is I come from the Acadian French First Language community. So I'm wondering how you work with, and I'm sure it's there, maybe it was on the other 20 slides that you didn't present, but what we do for folks that reach out that don't speak English as a first language and might have some issues dealing, some linguistic issues when they're in crisis and working or seeking supports.
Usually we'll reach out first to the membership to see if we have any officers that are working that speak that language. And if not, we'll use the interpreter services.
Okay, great. Thank you.
Thanks for that question, Doreen. We'll move on to Councillor Hinch, please.
Thank you. Hi, Dolly.
Hi.
I'm on the Board of Police Commissioners, so I got the whole presentation yesterday. And I don't have many questions. I just want to say thank you for your service and all that you do and all that your team does. And yeah, that's all I have to say.
Thank you, Virginia.
Thank you, Councillor Hinch. We'll move on then to Cheryl Kopaj for your question or comments, please.
Sure. Thanks, Dolly. I'm really interested in the program and services that you provide. I have kind of two questions. Just on the interpretive services, I know in Halifax that we have a large Inuit Inuktuk population, and I'm wondering if, and that population seems to be growing. So I'm wondering, is there like translation services for them? Because a lot of them still fluently speak their language when they come down from north, and it's very a big adjustment coming from the northern communities to the Halifax area. Right. So that might be something. And that's same with Mi'kmaq, because I know that the hospitals and that had trouble with securing Indigenous translation services. And then the second question I wanted to pose to you is, what other types of supports do you have in place? Because I know with the Indigenous community, they particularly don't like reaching out for any support services, victim services, just because they're so petrified of the children being apprehended or as soon as they report it going into the system because of the historical traumas that Indigenous communities have had. So I'm just kind of curious what you're doing to address that issue with our population.
Well, we work quite closely with the victim service worker over at the Mi'kmaq Friendship Center.
Oh, through MLSN?
Yeah, and the Friendship Center as well. But we have close ties as well to the MLSN with Karina. And so oftentimes if we have somebody that's contacting us, then we'll reach out to them first to kind of get a feel for some of the questions that we might be asked. How, can we offer to do maybe a Zoom meeting or telephone meeting with them present? And so those are kind of how we kind of work together with them.
It's great to see that you've connected with Karina, because that's who I was going to suggest. Yeah.
We have personal cells.
And she'll talk your ear off.
Yes, she will.
Yeah.
Great. Thanks for that, Cheryl. We're going to move over to Liz, please.
Dolly, first, my heartfelt congratulations to you on cutting a presentation in half and still getting all the info in. That's very difficult to do. So, congrats. I have a question and a comment. I didn't do either for the last guy, so I'm permitting myself both. I just want to really congratulate you on that offender navigation program. That is, as you know, extremely overlooked in terms of this area, and also, as you know, is one of the most effective interventions to provide safety for children, for survivors of abuse, and for people who behave violently who are often survivors of abuse themselves. So that's a really, really wonderful program, and I'm really pleased that you have it in place. My question is whether you have given any thought to advocacy on behalf of victims or survivors within the institution of HRP. When you are saying that people who have survived an assault are experiencing a 6 or 7 hour interview in order to report what's happened to them to police, like, it's wonderful that you have the victim services support there to try and help them process that as it's happening and recover from it after it's happening. But that's a tremendous trauma. And I wonder, I know in other places, not usually in Canada, because we are not
We're
perhaps
slow.
in line with best practices all the time. We're doing our best. But I know that there are other practices, such as having those interviews not conducted by police at all, or having them broken up into separate sessions, or all kinds of other best practices. And I wonder if you've given any thought to the ways in which your little piece of HRP could be providing education and advocacy within HRP to reduce harm that's caused by the institution.
Right. So, so we do a lot of training with police, and one of the specific trainings that we do with them is the trauma-informed approach to policing. And so we spend a lot of time talking to police about what trauma looks like for a victim, why they may answer questions the way they do, why they don't remember things in the order that they happen. We do a really good quiz with them around, you know, organizing thoughts and the way the police would organize thoughts as opposed to someone who's just been through a traumatic event. We really try hard to make those situations where they're coming in for their interview as kind as possible and as gentle as possible. When we have Allie over there, Allie makes them take frequent breaks. She'll go outside with the victim for a walk around, take a break and go walk around the building, make sure that there's, food and especially if they bring their children, we make sure that there's always two of us there if the children are there so that we can, be helping back and forth. So it's a really difficult thing. However, police feel that they need to do it in the one shot because they don't want to traumatize them twice by bringing them back. So, and oftentimes the video audio is so important because, a lot of women will then not want to go through the process. So if we have it on video and audio, sometimes the judge will allow that testimony. So, it's a work in progress, and, police weren't always as trauma informed as they are beginning to become. And so I think, we always ask, would you prefer a female investigator to question, or do you want a male? Do you want to bring your children? If you do want to bring your children, we can make sure that, we'll bring toys and stuff over. And are you okay with, with one of us staying with them while you're doing what you're doing? And also they can bring their own support. We had a woman come over yesterday and she brought her eFry person with her. And, folks are good with that as well.
Thanks for that.
Great, thank you very much for that. Rhiannon, over to you, please.
No specific questions. Thank you for your presentation and thanks for the work that you do.
Thank you.
Great, thanks, Rhiannon. So Cheryl Murphy, over to you, please.
So, and I don't have specific questions either, but I do want to compliment you, as Liz did, on the offenders program. There is sometimes we tend to throw people away when their situations or their histories have led directly to why they're involved in this situation. So I think it's wonderful that we're showing men that they are redeemable. They will never ever believe they are unless they're told.
Right.
So So
Thank
thank you, Dolly. It's a wonderful program all the way around, but
And
and
the really good news is that they are still reoffending, but they're not reassaulting. So they're reoffending by breaching their conditions, by, you know, drinking or missing their curfews, but they're not reassaulting.
Mhm.
And that's the best news. Yeah. That's how we're measuring our success.
yes, and that is success, right?
Thanks, Cheryl, for that question and comment. Thanks, Dolly, for your presentation. That was really good information. But I noted that in your presentation, you said that 97% of cases that you see in victim services are among women. And I just wanted to sort of throw the light back onto gender-based violence, and particularly violence against women and children, and how that actually directly impacts their choices to leave. And I know this is a really contentious issue, but I think also hear you say that for economic reasons, women will stay. And I think, you know, my question is, you've had this question before, I'm sure, Dolly, but really it's about the fact that if women had alternative housing, if they had income, if they had food security and those kinds of basic necessities for themselves and their children, the likelihood of them going back to that partner would be very low. So it's troubling that 97% of the cases are women being abused by male partners, and that, again, as you mentioned, they will go back to those male partners because of largely because of economic issues. So I'm just going to put it out there, this notion of how victim services can alleviate that need to go back to an abusive situation. Again, the fact that many of the male offenders are not reoffending using violence, but the verbal threats, or the threat of economic issues, retaliation economically is again a form of violence against women that often is perpetuated in those kinds of circumstances. So I just wonder if you could talk a little bit about how victim services is helping to ensure that women are provided with alternatives to get out of that situation, and again, recognizing that it's housing, food, children's welfare, etc. And I'd be happy to hear your thoughts on that. Thanks.
So a lot of the work that we do around advocacy for victims is, in particular, let's say EPOs. When a woman is granted an EPO, you know, we encourage her to speak to the JP about maintaining that the bank accounts stay the same for the 30 days, no money's withdrawn. The lights in the lights in the water are left on if they're in his name. She gets possession of the vehicle to transport the children back and forth to school. And then we always, you know, encourage them to reapply again so that it can get extended for that extra 15 days. And then we'll really advocate for her to get in to see a lawyer to get exclusive possession of the home. So, you know, a lot of women don't realize that, you know, they can get exclusive possession, and that, so we do a lot of work around that. With the Devon program, a lot of women will let the offender come back because he's cold and he has nowhere to stay. So she's letting him in after midnight because nobody will see him come in, and then he's drinking, and then, you know, he may assault her again. So if we're helping him find a place to stay, getting him into a shelter, getting him, you know, if he's couch surfing or whatever, then he's still able to maintain, you know, paying the bills or keeping the rent paid or whatever. A lot of them breach because they're trying to get money to her to pay the rent. So by having like programs like this, like Devon, we're able to kind of get him set up too, so that somehow we can maintain that peaceful approach so that people can still get their bills paid. Now, there are those, you know, I call them the 20%ers that will not, they will withdraw every bit of money from the bank account. They will, they will do all those. So we work really closely with income assistance to get emergency money. With child protection, we know they have little pots of money that we can take advantage of. We are very lucky to have one of the big travel agencies in the province who are very happy to supply us every year at Christmas time. Instead of exchanging gifts, they buy gift cards and donate them to us. So we'll take our gift cards and go out and fill up the fridge if we need to. So there's ways, and then, but I think once a woman feels supported and knows that she has a circle of support, she's not on her own, she finds power in that. And I feel like that gives a lot of women the power, the will to not have to take them back if she knows that there's other people that are willing to step up and help her sort it out.
That's great. Thanks for that, Dolly. Yeah, it's very troubling, and the issue of housing and food security are the kind of priorities of this committee, and so that's why I wanted to specifically ask, how does this program help get women fleeing from domestic violence into suitable, affordable housing, and make sure that the women and their children have food and can survive without having to take back a partner that may risk reoffending, and then that whole cycle starts again, et cetera. It's obviously not something that children should be ever exposed to, and women should never be exposed to. But again, there's lots of information in the literature to say that the high rate of reoffending in whatever format is really the problem. And I don't want to get into a whole big lecture about misogyny, et cetera, but really it's a difficult cycle to break when
it is.
Yeah, it is. Anyway, and I'm not telling you anything you don't know, Dolly. So thank you so much, Dolly, for being with us. I hope that you will come back. And again, if there are updates that you want to share specifically around the connections with housing and food security for women trying to flee from domestic violence through your programming, we'd love to have you back to hear more about that. But for now, thank you very much for your time, Dolly.
Thank you. Thank you all. Take care.
Take care. Bye for now.
Bye-bye.
Hi, everybody. Does anybody need a stretch break or a bio break or any kind of a bio break? No, yes, Cheryl, no. Okay. So we're gonna take a 2-minute pause. Do not hang up, just mute yourselves. So nobody needs to hear or see what you're doing, and put your TV off, and then scamper away, come back in 2 minutes. We're going to be done by 6:30. Okay. So I know we have a start time for our meetings, and we generally don't have an ending time for our meetings, which I think causes some anxiety because I know people have other things they need to be doing in their evening. So I'm going to suggest that we wrap up today by 6:30. So please bio break, stretch break, and come back in 2 minutes. And we'll get moving on to our next item. Is that okay, Elizabeth? Sorry, I'm taking some artistic license here.
Yeah, I think that's a good idea.
Okay.
Get a little break.
Is it okay with you if I go pee, Elizabeth?
I will allow that. Yes.
Thank you.
Cheryl, I didn't know. I just saw your message now. Sorry.
But all right. I know that we're going to do our
Work plan.
work plan. Thank you. I'm because I can't focus, I'm having I can't focus my eyes, I can't focus anything else, right? So anyway, I
Any
will.
reflections before you leave, just in terms of focusing on housing and food security that you wanted us to keep in mind?
I think I said it all, really.
Okay.
I mean, housing and food security, housing and food are our basic need,
Yeah.
right? And without our basic need, it is very difficult to focus
It's
on
true.
doing anything else for ourselves, right?
Yeah. Yep.
Like, and so without that, I really think that without that, you're creating a situation where there will never be success.
Yeah. Fair point.
Yeah. Anyway, I'm really sorry, but
That's okay.
this not focus stuff is driving me crazy. Anyway,
But Cheryl,
thank you.
if there's anything else, please email it to
Yep.
us, and then we can have a further conversation next time we get together. It's really about actions associated with those two key priorities.
Okay, so we want to talk about actions. Okay.
Yeah.
I will think about those things. Okay.
Perfect. Thanks,
All right.
Cheryl. Take good care.
All right. Thanks. Bye
Bye.
for now.
Bye-bye. Okay. Hi, everybody. Let's get rolling, shall we? So, Elizabeth, did you want to provide any update on any other issues that people had flagged as priorities, or have we reached consensus on priority number 3, housing and food security for women in HRM?
The priority number 3 seemed to be the consensus priority. Everyone that I did hear back from, that was the priority that they expressed they would like the committee to focus on.
Okay, that's perfect. So thank you very much. I hope everybody is comfortable with that. Before we get started on this exercise, in the next, I'm going to say 30 minutes or less will be on what are the actual actions that we want to accomplish around housing and food security. But I would gently remind people to look at the Women and Gender Advisory Committee's particular duties of the committee. And so we don't go too far afield, because we've got lots of great thinkers on this committee, and sometimes we like to think outside the box, which is great. But for the purposes of this committee, the committee shall advise council through executive standing committee on matters related to women as follows: receive and review municipal policies, priorities, and decisions using a gender lens, et cetera, et cetera. Advise on mechanisms to engage and empower women, et cetera, et cetera. Advise on, so some of those are not the focus of this work. So I just want to be clear that although there are pieces in there that will mirror some of the other priorities that are not our top priority for discussion tonight, it doesn't mean that they are not important to this committee. It simply means that we have limited bandwidth and we have limited time together. And if the consensus is that we focus on strategies to achieve the objectives of this committee, we're going to focus on housing and food security. And I just want to make sure that people understand that, because this is related to the committee developing, it says may develop, but we are developing a revised work plan for approval by the standing committee. So we really need to focus our efforts on this. And so if you look at pages, really it's 8 and 9 of the work plan that's been in circulation for a while now. What I'd like us to do is go through what is currently listed there. And what I have done is I've circled resources required, and fun fact, all of the actions require staff time, which is fine, but we need to do a little reality check about which pieces of the work plan are we meant to mobilize, and which pieces are then are we asking staff, noting that we have limited our own time is limited and we have limited staff time that we can draw on because we're not the only committee that staff are supporting. So just a little setting of the discussion for this evening. So if we go to the first item on the top of page 8 of the work plan as circulated by Elizabeth, and thank you for that. The committee will assess the current status of housing and food insecurity for women in HRM with careful attention paid to identification of subpopulations at particular risk. This is huge, so I'm just going to start us off with that is huge, as are the other subcategories. So we should probably have an open conversation because you've all read what's in item 3, which is now our number 1 action plan for this year, and look at the actionable items associated with that, plus the performance indicators. And again, big shout out to Liz Fraser for condensing this into a worksheet that we can work from. So with deep gratitude, Liz, I want to say thank you, and that as this conversation unfolds, things will necessarily change on this work plan. And I hope that it will mean things that are feasible performance indicators. And one important reminder is use the power of motions, not emotions, but motions, because that is something that we can do. So we can put motions forward, we can write letters, we can involve staff in identifying people that can come and talk to us about things like rates of homelessness among women in HRM, which I think is important to inform our discussions about how we use or formulate our actions and our time together. So that's my preamble to this conversation. We don't have a set speakers list for this item, so it is an open floor conversation. So we invite people to please use your hand and weigh in with your thoughts. And I think I saw Doreen first, and then Liz, and then, oh, Elizabeth, is this a procedural piece?
Yeah, I actually did have a speakers list in the, if you want to use it, but
Apologies,
if you want to do
sorry.
open floor, then that's
Nope, that's
totally
my
fine too.
apologies. Sorry, you're absolutely right. If you flip back to page 2, the agenda is circulated and approved. I apologize. The speakers list, we start with Doreen. So Doreen, over to you. The floor is yours.
I think mine are a couple of questions of just clarification and how we can proceed. 2 things. One is I'm wondering when we see a statement as large as that, and then whenever I see the word "and," I'm seeing more than one thing. So I'm wondering if we should be separating it out and talking about housing in particular for one, and then taking a look at food insecurity. Now, the 2 definitely feed off each other, but there could be different approaches or strategies or whatnot. And then the other question I would have is, should we be looking for starting with like what are the pre-existing committees that are like, when I read something like this, it feels like we're going out to do the work. It's just my ignorance of not knowing what else is happening within HRM, but are there not already groups taking a look at housing and or food insecurity? And maybe our role can be more working through those committees to provide or to have strategies or objectives that say, within their scope of work, how do our gender and equity lenses, how are they being represented in that scope of work? So we're not necessarily creating that body of information, but how are we influencing and impacting what's already happening? Now, if there aren't any committees, maybe the suggestion is get a committee or start working on it. But anyway, so I know I'm kind of a little bit all over the place, but I just need a little bit of clarification and maybe guidance on how we should proceed here.
Yeah, no,
Are you saying we should focus on that second sub-objective, Doreen?
I had a second sub-objective.
Well, no, because it's in there in the work plan under that food and housing. The second one is identify existing initiatives and examine.
Right. Yeah,
So are
that,
you saying you want us to focus just on that piece?
I'm almost wondering if that piece should be first. Right, because the first one feels like we'll assess, like the committee is going to assess the current status of housing and food insecurity. I don't think we have that mandate, but we definitely have the mandate to work with those committees that are, to ensure that our lens is, that's how I'm seeing it. I could be completely off base, but it's just a thought, like when I saw that first one going, whoa, really is that it is definitely something that we are very interested in and want to move forward. But if we're the only ones pushing for it,
No,
are we getting the word? Yeah.
we're not the only ones pushing forward, and we've had many presentations about housing, for example,
Yeah.
and about food issues. So I think the first part of your comments was, should we separate out food security from housing? Which I think, I'm just going to go back in time, just conjure this up in your imagination. Going back in time, I had suggested that we, good one, Rhiannon. I had suggested that we actually separate them out because they are
Oh.
in and of themselves huge topics. And so if that is the will of this committee, then we would separate out food security from housing. And to your second part, what is HRM already doing? That is, to Liz's point, the second point, which is the committee will identify existing initiatives aimed at addressing this issue, which would be these issues, housing and food security. So I think in terms of temporal order, it would be moving that up and separating out housing from food security, if that is the will of the group. But that's what I'm hearing you say, and I'm feeling the love for that suggestion. So I'll just put that out there. Thanks, Doreen. So we're going to move on to Councillor Hinch for your thoughts on our work plan for this year.
So what I totally agree with separating food security and housing for sure. The work plan, from what I can see, and I'm trying to understand it, is it looks good. So prioritizing 1 and 2. So here's my thing, I come from a housing background. Housing is one of the reasons why I ran, because there's not enough affordable housing, safe affordable housing. So that's a big component of why I ran and what I was hopefully to achieve, and trying to understand what that means now that in municipal government, because they're saying that they have no role to play within building the housing, but they're okay with funding certain projects and things of that nature. But the funding, even the funding component of it, is just not, it's not realistic to me, and as it's very slow in building affordable housing. So I mean, it's a priority for me for sure. This whole thing is very well thought out and very well planned. But if we want to start with the housing and the food insecurity, I think housing would be the first that I would rather go with as well, to see if there's something that we can really do to make it come to fruition, to make it sure that we can, provide housing, safe and affordable housing for moms, for individuals, for families, anything of that nature. So that would be my thing. As we know, the budget just came down, and the Just Food Action Program and everything. I'm still learning a bit about that more when it comes to food security and things of that nature. It looks like we have a good footing so far, and hopefully we'll continue on that path. So that's what I would say to that.
Councillor Hinch. So again, I'm hearing the suggestion of separating out housing from food security, and maybe starting with housing, and to kind of move on to the point of what existing initiatives aimed at addressing this issue exist. I think
Yes.
that's great. Thank you for that.
Yeah.
Okay, Cheryl, over to you, please.
Hi, I'm really around food security. I know that we have the Just Food Action Plan, and I know that there are some services that are being offered through the Friendship Center, but I'm really curious on how they're doing and how many people they're impacting and those types of things. So I think we kind of need to get that baseline there, because I know they started rolling out the programs. They have a worker there. But the other part I'm starting to really have higher levels of anxiety about is food security. There is such a need in our First Nations communities with especially with our women. Our women are going out fishing and harvesting. They're actually out on the river systems now, harvesting to make a few dollars to pay for supplies for their children. So they're putting themselves at risk going out fishing at night with just a dip net and waders on high water. So there are real security issues around this. So if we don't solve this food security issue, there women, especially Indigenous women, will exercise their treaty rights and go out on the water to try and make a living to support their families. So I'd really be interested to see what type of programs we're doing that are really taking that cultural lens, especially for women, into consideration when we're thinking about food security.
That's great. Thank you for that, Cheryl. So definitely looking at what's there in terms of baseline data. So I hear you
Yep.
on that, and particularly with respect to food security and Indigenous women. So how many people are being impacted by this? So
Right.
that's definitely an ask that can go to the HRM post and maybe a presentation on this question or issue. That's fantastic. Thank you for that, Cheryl. Liz, over to you, please, for your thoughts.
Excuse me, before we continue on, I thought I have a previous engagement to go to,
Okay.
probably the same one that Tracy is going to. I thought it started at 7, but it's starting now.
Okay.
So I will have to excuse myself.
Thanks
Well, we
for
will miss you, Counselor Hinch.
Thank you, Counselor Hinch, for your input so far, and we will miss you.
Thank you so much. I'll
Take
see you
care.
guys next time.
You bet. Bye for now.
Okay. Bye-bye.
Liz,
Away I go. So look, I'm a housing first guy, like a real housing first guy, not housing first light. But I'm a housing first guy from way back. So in my second shocking twist of the night, I'm gonna say I don't think we should bust up housing and food, even though I'm also a person who typically, as you know, I know, take deep breaths, Jackie. Even though typically I also like things to be real clean. But if we are gonna bust them up, we should pick food, and here is why. We have been in the housing space with our toes in the housing space for as long as I've been on the committee. We get presentation after presentation. Our levers on this are so limited. Like the municipalities' levers are so limited, and I can only imagine the frustration Councillor Hinch must feel. But the municipalities' levers are limited by some combination of external and internal factors. And there is an Office of Housing at the municipality that I feel pretty comfortable is working to their maximum scope of influence. And that remains quite limited, and that's because the province owns most of it. Like it's a provincial file. Nobody owns food. You know, the province owns agriculture, but nobody owns food. It could fall under a number of portfolios, but there's no jurisdictional issue. There's no butting heads. There's no, it's everybody's business, so it's nobody's business. And so that's potentially a space where a municipality can affect a lot more change. There's also money for it right now from a couple of different places, like Agriculture, Agri-Food Canada's doing all kinds of grant funding and stuff. So, you know, a motion that we made in support of implementing additional food security programming is one that could potentially advance. Like, I just think that's one where we could actually move the needle a lot more than housing. It's not to say that housing's not important. It is tremendously important, but there are so many players in this space. I wonder what our value add would be.
Okay, roger that. Very well said. I am scribbling notes as you're speaking, and we're going to turn it over to Rhiannon. You're next on the speakers list, please, for your thoughts.
Thank you. Liz, that's interesting. Lots to digest. Yeah, I mean, it's been said a couple times before. I do in general think it's a good idea to like at least lead with some type of the second point here, identifying existing initiatives and seeing what kind of like GBA lens they have. I do kind of agree with Liz that like, you know, I've been on this committee for almost a year now. Oh my God. And there's been lots of housing presentations and discussions, and a lot of them leave me with more questions and a lot of answers. But I do like I see what you're influencing me. I see, you know, the kind of scope that we can have or the impact that we can have in housing. I don't think that's a reason to like lose sight of it because it's like so relevant. And like I think of like that the presentation that we had about like funding for housing projects and like these questions about just like the unmet needs or the unknown needs of like specifically like queer and trans people that we were thinking of then, or like how to ensure that like rates of these projects are going towards like women and gender diverse people, like both upfront and long term. Like I think that those are important things to consider still. And I guess the other thing I'm thinking of, which is like not a useful thing to say because I know like we should be like actionable at this time, is like some of these things, well, it just seems like slower or long-term things. So I'm trying to like rack my brain right now for like shorter term like wins or milestones that we could bake into this. And I know I should have come here today with those already. But I guess recognizing that like, you know, this is longer term work, but like it'd be nice to have like a shorter win to get the ball rolling. Yeah, that's what I have.
Wow, a shorter win in politics. Ah, okay. Thank you for that, Rhiannon. I love that. I'm gonna get a t-shirt that says that. I'm looking for a shorter win in politics. Amy, over to you, please.
Thank you, Jackie. I thought maybe I'd just add a couple of things that I think could be relevant to what Liz you just mentioned, Rhiannon mentioned, and then I think other folks mentioned as well. So I have in my notes from the presentation that we saw from the folks who were speaking to the committee about affordable housing and the grant programs and sort of the systems and plans in place, that there is that upcoming opportunity. And I say upcoming, it looks like they said further engagement to be expected in 2026, but around the affordable housing strategy and housing needs assessment. That could potentially be something to dive into more with that staff team about how the committee might be able to engage specifically on the development of those two pieces within the kind of broader housing issue. And to bring forward pieces like you mentioned, Rhiannon, and Cheryl, you mentioned around queer and trans folks and housing, Indigenous women and Two-Spirit folks and housing. Like you could get maybe even more specific just as an offering to the committee, but obviously up to you folks about how you'd want to approach that. Also, just to mention that it might be interesting for the committee members to, I'm not sure if you've been following sort of the budget process this year, but there's been quite a lot of conversations about food security and the role that the municipality plays in food security. And so you'll see varying, I think, opinions on that. And for folks who haven't had the chance to watch those conversations, it could kind of give some insight in terms of where maybe some of the thinking is right now around food security and where there could be kind of like possibilities for the committee to provide some guidance, advice on the connection between food security, the municipal jurisdiction, and the work that you folks are focused on in the committee. And then the final thing that I'll mention is that I think is not as specific to housing and food, but it is, I think, a broader kind of really important guiding framework that would impact issues like housing and food security, is that the municipality is currently in the process of, and I'm not an expert in this, so I don't know, like, obviously we can find other people who can speak more specifically to this, but with every council, there's like a strategic priorities plan. And so currently engagements are happening around creating the new strategic priorities plan for this new council. And it's open right now to community engagement more broadly, but that could be another opportunity for the committee to have some like targeted conversations on that strategic priorities plan as it relates to the priorities of the committee. So just wanted to share those pieces.
That's brilliant, Amy. How do we get our foot in the door with the strategic priorities plan?
That is a good question, Jackie. Maybe Carla, you and I and Tracy could put our heads together on that. It would be a little bit of like fact finding on our end, but
because Amy, and I know you know this, and I mean this with all due respect, love in my heart when I say this, that this committee is really meant to provide advice on matters that relate to women and gender diverse people, on municipal policies, priorities, and decisions using a gender lens. So I feel like that's our jam. And if we can get our foot in the door, and I've got a big foot, I've like a probably size 10 and a half, 11. So I could just jam that sucker right in there. And so I would really like for us to be able to not be reacting or going cap in hand saying, can we please look at your policy? Can we please talk to you about something you're thinking about? I feel like what you've just suggested about the strategic priorities plan for the new council would be a really important opportunity for this committee to actually invite ourselves or invite counselors or invite somebody who's leading that planning process to come and meet with us and just do a gentle reminder of what the remit of this committee is, so that we can, I don't want to say drum up more business, but be more actively involved in living the duties of this committee. That's brilliant, Amy. Thank you for that. So that's an action for follow-up for somebody. I'm looking at you, Amy, but sort of looking at Elizabeth and kind of looking at Carla. So I'm just gonna I'll sort that one out. I think Doreen, you had your hand up first, but maybe Elizabeth needs to chime in with the voice of reason.
I don't know if I'm quite the voice of reason here, but I know there was something sent around for HRM about the 2026 to 2030 strategic priorities plan, and I'm taking a look at it now, or I'm taking another look at it. And so there is an option for just general residents to submit a survey, to fill out a survey, and there is a staff contact for the strategic priorities plan. And I'll send that, but I think staff can probably, maybe we could reach out to it looks like the planner that's assigned to this.
In the link you suggested, and
I sent the link as well. Yeah.
Yeah. If folks have not looked at it, you might want to look at it, because you can see the dot is flat on the online resident engagement period, and we are, I'm going to say, all residents of HRM. So we could provide input through this, and maybe perhaps you could say something about, don't forget about this committee, which is meant to provide the gender lens to proposed actions, plans, etc. for HRM. So I think that's important. But if we can also figure out another mechanism to figure out how engagement with this community can happen in a more fulsome way going forward, I think we would all appreciate that. Doreen, go ahead, please.
Yeah, this connects with Carla. I think it was with you. We were talking about having, and I'm just going to put it in vulgarized language because there's technical terms that are out there for this, but some kind of a checklist that we wouldn't have to be asking questions to say, hey, don't forget about us and what our role is. And I know, I have a feeling there was, I thought it was through you that we had some kind of a presentation where we were taking a look at, for lack of a better term, like the checklist, because we shouldn't have to be reminding people, oh, by the way, before you come out with this strategic plan and you send it to us with the, how do you think, or what do you think about it? We should actually be part of that planning process as it's being put forward, because even with consultation, we should have a lens on how people are being consulted from that gender and equity lens, just to, not that we have to okay everything, but like, maybe there's a question that needs to be reformulated. Maybe there's something we forgot. So we could be going off in a complete different direction.
That's a great point. And I think my question to the planning committee is, how are you consulting with the various sundry committees that volunteer with HRM to provide advice or whatever? So that's my question, is it's not just this committee, but how are all of the volunteers, all these committees within HRM being invited, other than if you live in HRM, you can just fill out the survey online as a member of HRM, as a resident of HRM. So I'm next on the speakers list, but I know, Carly, you haven't had a chance to weigh in with your thoughts on this. So I'll turn the floor over to you and then I'll move on to my comments.
Yeah, I can't remember when I would have said that, but it is something that I'm working on with the Women and Gender Equity Strategy. But having said that, accessibility has a checklist. There's probably going to be a checklist for anti-Black racism. Like, there's going to be a bunch of things, and I think that we should really get in there and make sure that women, and then Cheryl, I believe, brought up senior women specifically, that always, and I'm guilty of this as well, because after I did my first draft of the Women and Gender Equity Strategy, I looked back and there's no mention of senior women, so I had to go back and do that. So the checklist would help me as well. So I'm not sure how that all fits in with the strategic planning, but it would be a good idea to get it in before they finish.
That's great. Thanks for that, Carla. And I think if there's a checklist or a reminder, have you consulted with the HRM committees on this policy, this strategic plan, this whatever, so that it's not just us, it's all of the lenses that need to be brought to how these policies or interventions or whatever they are being formulated. I think that's, for me, the important message, because I kind of feel like we're sort of running after a speeding train, trying to say, like, wait a minute, what about us? We have something we want to add. So so thank you for that. And if there is a way of getting ourselves inserted into the HRM strategic priorities plan for the new council, that would be a gift. So thank you, Amy, for mentioning that. And just in terms of my own feedback, if this was an in-person meeting, Liz, you'd be in a lot of trouble. No, I'm just kidding. Because I think housing and food security belong together, and I'll tell you why. I think both housing and food security disproportionately impact women and gender diverse individuals. And so I think they belong together, because if you are precariously housed, your food security is going to be bad. If your food security is bad, chances are your housing precarity is probably quite high. So I feel like there's a good synergy there. So I feel the love for keeping them together. However, having said that, what about the idea of Liz is the point person for food security subcommittee, and we appoint somebody else to be sort of the subcommittee lead on housing first, or housing, and that we work together, sort of, you know, having conversations when we get together is great, but having the opportunity to actually dig deep when we're not together and look at some of the policies and procedures and et cetera that are already in HRM that we are expected to work with, which is fine. But we are volunteers, and I feel like we can only do so much, but I really feel that, like a sandwich analogy, food security and housing go together. If you don't have one, likely you don't have the other. And again, as I said, they are disproportionately impacting women and gender diverse people in HRM. And that is my mic drop for today. Liz, over to you.
I love the idea of a subcommittee, because I think subcommittees are usually pretty useful. You will, of course, have to find someone else to lead the food subcommittee, since I will not be there. But I think now that I've brainwashed Rhiannon and I've persuaded her, and since she's my natural successor in charm and spicy remarks as well, and as soon as I leave, she's going to fill that void, I think she's the natural person to do.
All right, no pressure, Rhiannon, but what do you think about the subcommittee idea? And that means we have a reporting out of the subcommittees and the work that we do kind of offline and or in consultation with HRM staff. And we can sort of split and then reconvene at our monthly meetings. I just feel, my fear is we're all super busy people, and what I don't want to do to all of you busy people is have you sit in a 2-hour meeting and feel like we are not accomplishing our desired outcomes for our work plan. So I feel like if we can do subcommittee stuff, and I'm happy to work with the housing people. I think we're getting a lot of interesting feedback and potential momentum within housing. And I think, Amy and others are, part of that, making that happen, identifying who are the right people in HRM or more broadly, who can come and speak to us about these pressing issues. And I think we can do the same with food security. And it's figuring out how to motion, letter write, and advocate and say, please remember this committee is here to look at whatever sundry policies, programs, et cetera, you're developing, that we are here to put a gender lens on it and give you our honest, informed opinion on how that could better serve women and gender diverse people in HRM. And that's essentially what I imagine our work plan being. Amy, go ahead, please.
Jackie, yeah. I just wanted to, we do have some information to share with you folks about the subcommittee. So Elizabeth kind of screenshotted a little excerpt from the administrative order. And it does require, so for the creation of subcommittees, there is a bit of a process in terms of like creating those, because and Elizabeth, I think I might need your help in terms of like process pieces here, but like a formal subcommittee requires like staff to be there to take minutes, to like have that be available on public record and all of those pieces. So to go that route, there are a few things that need to be in place. Like it asks the committee to together, and I can imagine it doesn't have to be that detailed, but yeah, Elizabeth has it up on the screen here. Identifying the goals, timeframe, scope of work, and resources required, because that would also help us as staff to understand, like for example, 2 subcommittees, say if you folks were like, we want to meet 5 times a month, we would probably have to like seek out, I know that's probably not what you're thinking, but once a month for one subcommittee versus many times a month for 2 subcommittees, like that would all kind of play into whether or not staff would have the capacity to be there with the subcommittee. So yeah, I don't know if Carla and Elizabeth would want to jump in to add any more information there, or I know Rhiannon has her hand up too.
Elizabeth or Carla, thoughts on this subcommittee idea?
Can I just ask a quick question? Is this about the name? Because really what we're looking at, if I understand correctly, is working groups to be able to come back.
Okay, working groups.
Yeah.
Working
groups. So call them informal working groups, because it's just really to try to give us a chance to formulate some ideas that we're not going around in circles and having time to think about something specific. So I don't know, is it just in a name? That's the problem?
It's the name and the process as well, because the subcommittee, you have to have a separate work plan, and then I believe it has to get passed by the executive standing committee in order to create the subcommittee.
I think that's more formal than we'd want to do for this work. And
Yeah,
there's already work that the committee does that's not minuted, right? Like the chair is doing stuff that's not minuted behind the scenes. So a working group, trust you to think of the perfect way to frame it, Doreen.
So I think Rhiannon, you had your hand up, and then Elizabeth, and then we are done for the evening because it is 6:30 and I like to stick to my promises.
Yeah, I was going to say a similar comment about the working group. In general, I'm also like down to clown on subcommittee staff. Less knowledgeable in the area of food, but love work. Yeah, but noting that this may be a larger process, if it's something we want, maybe we can think about it before the next meeting
Yeah.
and prepare.
Okay, that's brilliant. It is 6:30, and I'm going to ask, just as a way forward, that Elizabeth share that nugget of wisdom that you highlighted and shared in the on screen, and so people can refer to that. I'm sort of feeling that we should stay together as a loving group of housing and food security people, and we should share the wisdom between the groups and not be dividing off. I still feel like there are other ways of drumming up more interest in what this committee can do to bring a gender lens to all of the amazing stuff that's happening in HRM. I completely respect what Amy is saying and Carla is saying and Elizabeth is saying about bandwidth. And if we do go down the rabbit hole of subcommittees, it creates its own, kind of a work plan, etc. So as an action, I will revisit the work plan as discussed. I've taken notes, and if we're okay with that, I will kind of rework some of what we had proposed in the work plan, the never-ending work plan, and then send it out to everybody for your feedback in advance of our next meeting. And then we can sort of land in a good place and just, get moving forward with the focus on housing and food security. That's my offering to you this evening. Are we okay with that?
That sounds great, Jackie. Thank you.
Okay, thanks, everybody. Take good care. Elizabeth, oh geez, yes, we're still. Sorry, I'm like, see you later. I'm hanging up on you. Oh, just you wait. Okay, so there are no added items. Sorry, we're on item 10. There are no added items. Our next meeting is May 1st. We may be meeting in person. And if we do, our vice chair, Doreen, has agreed to chair. I will be at a conference, and I would like to move for adjournment, please, and thank you. We just need a mover for that. Oh, Elizabeth has something to add. Just hang on, Rhiannon. You're hot off the press there. Just 1 second. Elizabeth.
Sorry, I was just going to update really quick, or just make sure that I'm passing along the correct message when I meet with like other staff from the clerk's office, aka like my supervisors or people above me that know more about these processes than I do. What I'm understanding is it sounds like we're more looking toward an informal working group as opposed to an official subcommittee. Okay, because I will be meeting with like other staff and members of the clerk's office to kind of see what that would look like. So I'm glad we got the clarification. That was all I wanted to ask and clarify. Thank you.
Thank you. If we could have a motion to adjourn, I just need somebody to jump up quickly. I think that was you, Rhiannon. Okay, Rhiannon, it was a tie. Rhiannon and Doreen, you both win. Thanks very much, everybody. Take good care. Enjoy the rest of your evening, and we'll see you soon. Bye for now.
Thanks, ladies. Bye.
Bye, everyone.
Bye.